and welcome. So glad you could join us today. My name is Jill Franken. I'm the Public Health Director with the City of Sioux Falls. This is a fitting day to be talking about our latest Community Health Status Report, because this week is National Public Health Week. This week is organized by the American Public Health Association, and it's really designed to foster communication across the country about building healthier communities and being healthy as communities. You know, everyone deserves to live a long and healthy life in a safe environment. We believe that's true in Sioux Falls as well. To make that possible, we need to address the causes of poor health. We need to realize the causes of disease risk amongst our individuals and within our communities. For example, you may have noticed some folks outside who are doing blood pressure checks today. Out in the lobby, please stop and get your blood pressure checked if you haven't done so recently, because April is our big squeeze month, and it's one of the ways we can really talk about blood pressure, hypertension awareness, and get the community activated around this important chronic disease issue. So please, again, all of you, stop by and get squeezed. To provide a little historical background about health assessment in Sioux Falls, the Sioux Falls Health Department actually started doing this work back in around 2012 with our first health status report. And it was looking at the indicators of cardiovascular disease as well as diabetes, obesity, some other risk factors around chronic disease. And then we introduced Live Well Sioux Falls, and with that, some team members who've really helped through the health department lead that initiative and really how to improve health and well-being in our Sioux Falls community with a bunch of partners that work with us and with our Sioux Falls residents as well. In 2014, we partnered with our two outstanding health systems on a newer collaborative process to put out a community health status report. And that work first was produced in 2016, and then we're already here 3 years later with a report to share with you again in 2019. So I'd now like to introduce Dave Fleechek, President and CEO of Avera McKinnon Hospital and University Health Center, to say a few words, and then we'll call up Dr. Wilde. Thank you.
Thanks, Jill. It is great that the two health systems can come together with the city to help with the community well-being of health. I am here on behalf of the entire health system, Avera Health System, and we are proud today to talk about community health and the unique and positive collaboration we have enjoyed as health partners. On the national level, the expectation of hospitals is to play an active role in the health of their communities and make it an even higher priority. We have had the opportunity to work together with part of Live Well Sioux Falls initiative, and we certainly saw the value of coming together with the community assessment, which is a very comprehensive document on the health needs and assessments of this community. Making an impact on public health and changing health behaviors takes time. It requires a systematic approach that looks at many factors that impact the health of our communities. We have much work to do, but the report we are presenting today provides a valuable roadmap to guide us as we continue to improve the health of our community. As we work together as partners, as health systems in the cities, this will be a valuable roadmap for us to take care of our friends and neighbors. Thank you.
Thanks, David. That was great. I'd now like to call forward Dr. Mike Wilde, Vice President, Medical Officer for Sanford Sioux Falls, and invite him to come up and say a few remarks. Thank you.
Thanks, Jill. And thanks, Dave Fleechek, for those remarks. And want to express my appreciation of being able to represent Sanford here this afternoon and be in front of this great community and audience. And certainly, as Mr. Fleechek alluded to, very proud to announce or very proud to roll out how we've collaborated on working in this project over the last 15 months. And why it's taken 15 months is really to gather the information in a proper fashion so we can represent the community of Sioux Falls, represent the community of Sioux Falls not only through survey but also through focus groups, through personal interviews, to identify the right populations that express hopefully the feelings of the majority of people that reside in this area. Working with that and that multi-pronged approach, we also worked with elected officials as well. We're trying to continue to design programs and services to meet our residents' health needs. We need to understand the environment in which they work, they worship, they go to school, and spend their time. And that really is what a community health needs assessment is all about. And we're truly proud to work with our partners at Avera and the city in regard to this community health needs assessment. So thank you.
Very good. Thank you, Dr. Wilde, very much, and thank you both for being here today. So truly this effort would not have been possible without their leadership and the folks that they're on their teams that have brought this report forward. Through this great partnership, we're learning more about what impacts the health of Sioux Falls. Our health behaviors and our environment, right down to our zip code, as a matter of fact, can predict how healthy we will be as individuals and as a community. So all of the assessment partners will be here today to answer questions and available to just discuss, how this report came to be and what it all took to make this happen. But I'd also like to now introduce Mary to come up and talk a little bit more about what's in the report. Mary?
So good afternoon. I'm Mary Michaels with the Sioux Falls Health Department and Live Well Sioux Falls. And as Jill talked about, there are many different factors that impact our health. And it's everything from jobs and education to transportation and housing. And we're currently living in an age where our zip code is a better predictor of our health than our genetic code. In large metropolitan areas across the country, we were seeing that residents just a few miles apart were experiencing very different health conditions, very different life conditions. Because neighborhoods where you have limited access to healthy foods, places to be physically active, places to engage with your fellow residents, access to transportation options and health care, all of these areas often see higher rates of chronic diseases like heart disease, cancer, obesity, diabetes. And what we learned through our health assessment is really that Sioux Falls is experiencing the same thing. So to my right, you see a map, and this is a map of life expectancy in Sioux Falls. And there was a tool created by the Robert Wood Johnson Foundation. Oops, get my slides to go the right way here. Sorry about that. There we go. And this tool can actually map life expectancy down to the neighborhood level. And so looking at our own city limits, there's a difference of more than 14 years between neighborhoods in Sioux Falls, with the lowest around 71 years and the highest just over 85 years. Now these two neighborhoods, the high and the low, are only about 5 miles apart here in the city. So in the United States today, 7 of 10 deaths are caused by chronic disease, and many of these diseases are preventable. And many of these diseases are impacted by those social determinants of health: housing, education, transportation, safety, and social engagement. And so by addressing these factors as a community, we can help prevent people from experiencing poor health by providing those conditions that are necessary for them to be healthier and to have healthy choices available to them. So over the past year, we explored a number of health indicators and health conditions that you'll find in that report. But today we're going to focus on a few key areas. So as a group, as we went through this process with our partners, we started with a long list of items and used these discussions we had with community partners to really bring up these 3 priority areas of access to care, behavioral health and substance use, and chronic disease prevention. So the World Health Organization defines health not as just the absence of disease, but really a state of complete physical, mental, and social well-being. And so researchers have really been taking a new approach to looking at health and looking beyond just causes of death and looking at the relationship of health to a person's quality of life. And so all of the areas where we worked with our community partners to gather information really lent to these three really rising to the top as priority issues that we should look at as a community. So we'll talk a little bit about each one of these areas. So first of all, with access to care, even though we have incredible health care assets in our community, residents still identified access to care as a concern. It is important to note that access really can mean different things for different people. It might be transportation, it might be cost, it might be awareness of what's available in the community. And so we need to look at all of those different factors. But in general, access means that a person has the ability to understand what health resources are available in the community, that they can gain entry into the healthcare system at a location where their needed services are available, that they can find a trusted healthcare provider, and then they have ability to pay for their needed services. But unfortunately, disparities exist when it comes to access, and those can include things like age, gender, race, ethnicity, income, and even geography, where they live in our community. So when barriers exist, it can lead to unmet health needs, delays in receiving care, or financial burdens. And through our resident survey, we saw those things come out, where 64% cited cost and access as health barriers, and 16% saying at least at one time or another, care was delayed because of cost concerns. The second area, behavioral health and substance use. Obviously, there's a lot of information that goes into this category. Just wanted to highlight a few of these things for you. So our mental health is so important to our well-being because it impacts our ability to maintain good physical health. So when asked about their own experiences, 37% of our residents said that they had a past diagnosis of depression, 37% had a past diagnosis of anxiety or stress, 12% had been diagnosed with panic attacks, and 6% diagnosed with other types of mental health issues. And according to the Helpline Center's Community Trends Report, the top issues for teens contacting the Helpline Center are suicidal thoughts, relationship issues, loneliness, academic struggles, and just needing emotional support. Overall, suicide-related contacts to the Helpline Center increased by 34% from 2016 to 2017. Binge drinking is another area we've been looking at through our health assessments. And when we look at our national data on binge drinking, the numbers have remained fairly constant over the last 3 years at about 20%. The interesting thing was when we looked at our resident survey conducted as part of this assessment, residents were asked within the last 30 days, how many times or have you ever consumed more than 4 or 5 alcoholic beverages on one occasion? 38% indicated that they had engaged in binge drinking. So much higher than what some of those national numbers were showing us. In the area of prescription or other drug use, residents through the survey indicated they were indeed very concerned about drug use and the presence of drugs and drug dealers in our community. According to the Sioux Falls Police Department, the top drug seizures are marijuana, methamphetamine, and prescription pills. And this slide also shows the rates of opioid overdose mortality for the U.S., for the state, and Minnehaha County. So here in Minnehaha County, we're a little higher than the state, but still a little lower than the national average. But what you'll find inside the report, in the section that's talking about drug use in the community, there's a page where you'll see a series of color-coded maps of the U.S. And you can see over the years how that color shading has changed with the spread of drug overdose deaths in the country. So alcohol and substance use are going to continue to be important issues of topic here in our community and in communities across the U.S. Because whether we're talking about alcohol or other substance use, it's not just an impact to that individual. It's an impact to their families, to their employers, and to the whole community. Research estimates that for every individual dealing with addiction, there are 4 people who care about that individual who are trying to support that recovery. The third area is a big one. This is a big umbrella that covers a lot of different information. So we talked about the differences in life expectancy, and our nation lags behind other comparable higher income countries when it comes to life expectancy, despite the fact that we pay more for our health care here. Approximately 71% of the total healthcare spending in the U.S. is associated for care with Americans with more than one chronic condition. Over 2/3 of people, adults in our community, are overweight or obese, and obesity is something that has increased since the last report. And it's something actually that we've seen nationwide. When we talk about overweight and obesity, it was always overweight was a larger number, obesity was smaller, and that is now flip-flopped, where we're finding more people in the obese category than overweight, and that's based on body mass index, or BMI. There are more than 200 diseases associated with excess weight, and that impacts every single organ of the body. And these diseases are costly. Expenditures related to treating obesity-related illness in the U.S. is at about $480 billion. Research has shown that for a person with a BMI, body mass index, of 40 or greater, which is where you classify somebody in the obesity, if they were able to reduce their weight by just 5%, they could see a decrease in their annual medical expenses of about $2,000. So when we look at the rates of preventable chronic disease, more than half of Americans also have more than one diet-related chronic disease, so things like heart disease, diabetes. And so in Sioux Falls, one measure that we've looked at with respect to our nutrition and our diet is fruit and vegetable consumption. Fortunately, Sioux Falls still remains in the very lower strata of the nation in terms of our fruit and vegetable consumption. We've inched up slightly, but still only about 15% of adults in our community are meeting the daily recommendation for fruit and vegetables. Physical activity, we're supposed to be aiming for about 150 minutes of moderate to vigorous activity each week, or about 30 minutes a day on at least 5 days a week. Through our resident survey, only 18% stated that they are physically active 6 or 7 days a week. Over half were active fewer than 3 days a week. In recent years, you may have heard the term sitting disease, and that's used more than often to refer to the negative effects of physical inactivity. One study estimated that the average American spends 55% of our waking time, or nearly 8 hours a day, in sedentary behaviors such as sitting. So I should probably have you all be standing during this news conference. But hypertension, heart disease, there's so many chronic diseases that are so related to that nutrition and physical activity that it continues to be a focus for our community. It also impacts hypertension. And Jill talked about the big squeeze, the blood pressure screenings that are happening out in our community. We've been doing this with our community partners for over 8 years now. And what we continue to find is only about 1/3 of our residents who are getting screened as part of the big squeeze have normal blood pressure. Now, in 2017, the American Heart Association updated their blood pressure guidelines after years of research, and it had been a long time since the guidelines had been updated. The impetus behind that was really focusing on these lifestyle factors that are contributing to hypertension. And when we look at our rates in the community based on the new guidelines by the Heart Association, we're finding that about half of our adults in Sioux Falls are classified with high blood pressure. So do get those blood pressure checks. We continue to look at nutrition, physical activity, stress management, tobacco use, all of these modifiable risk behaviors. Tobacco use is actually where we have some good news to share. About 2 years ago, the city adopted a policy regulating tobacco use on city property to provide healthier environments, reduce exposure to secondhand smoke, and it's been successful. We've seen this expand to covering events in our parks and other city facilities. And since our last report, our adult smoking rate in Sioux Falls has decreased from 16.7% to about 15%. So great news. We still have some work to do, especially when we think about our youth, the use of electronic devices, but we are making great strides in the area of tobacco. So these modifiable risk behaviors, really looking at the 5: tobacco, nutrition, physical activity, healthy weight, and alcohol consumption. Research estimates that if 75% of Americans were working toward those 5 modifiable risk factors, the nation could save more than $600 billion a year in healthcare costs. That's a big number by making the little changes in things that we do every day. So beyond what we all experience in our daily lives related to our individual health, when we look at the overall health of a community, it is a core element to economic vitality. There are dollars and cents to healthcare and health costs. but there are also dollars and cents in benefits that result from investing in prevention. So after compiling and reviewing all of this information that's in the report, the partners came together to select some priority initiatives that we want to look at as a community. Certainly there's things that we do at the health department. Avera, Sanford have strategies that they are working toward every day, but we came up with these as issues that would really be good for the community, whatever sector you're in, education, healthcare, nonprofits, government. These are things that we can all find a role to play. So the first one is supporting the development of the triage center, which not only addresses things like addiction, but it's that access to care piece, helping people get connected to services they need. A community-wide effort and approach to behavioral health awareness to encourage people to seek help, to reduce the stigma that surrounds getting help, and to make people aware of what resources are available in the community. Increasing residents living at a healthy weight, again, focusing on those nutrition, physical activity, how do we shape our environment so that a healthy choice is an easy choice for somebody to make and impact some of those rates of chronic disease. And then addressing those social determinants of health. And we can do that by actively supporting the One Sioux Falls framework that Mayor Tenhaken had addressed. Anything that you find in the report can roll up into one of these 4 primary areas. And so we are excited about the potential that we have to make an impact on the community. Now you've heard us probably say the word partner a number of times already this afternoon. And this is just a little picture of who we're talking about. So Live Well Sioux Falls could not do what we do without all of your help and the support of these incredible organizations, whether it's participating in the community health assessment process, being big squeeze screeners, being part of our Sioux Falls Food Council. There's so many different ways that partners have engaged with us, and we are so fortunate to be able to do that and to look at how we can make our community a healthier place. As we wrap up today, we hit some highlights, and we've done it pretty quickly. There's a lot of information in that report. There's so much more in there. We go a little more in depth into some of those social determinants, looking at some figures related to housing, education, transportation, but we also look at things like food security, oral health, workplace health. And so there are so many different topics and that we can address, and certainly there's going to be those opportunities as community partners to do that. And so we don't want it to seem like we're favoring one over the other. Certainly when you look at health factors, it's hard to say that one is any more important than the other one. It's not unlike when you go out on the road in your car. You can't pick which tire is more important because you need all of them to get you where you're going. In the same way, there's not one single entity that can address these health factors, but as a community, we can. So we appreciate you being here today. Take a copy of the report. We'll also have it on our website. But thank you for being here, and I will turn it back to Jill.
Okay, I'm going to go a little off script here. So first off, I want to thank Mary for the work in leading up this effort. And I want to ask those of you who are on the project team to stand so you can be recognized as well. If you would, please. Teresa. Yep, stand up. Teresa, stand up. Thank you very much. This map is really quite stunning, isn't it? This is really about what we need to know right here. When I think about the work that we did to make an impact on tobacco in our community and start seeing those rates come down, it wasn't just about our policy at the city level. It was many of you in this room partnering together to really create that awareness. And we need to do more work, certainly, but we've made some inroads. I'm absolutely confident that we can do the same with those strategies that we have agreed that we'll collaborate on as a community to make a difference so that we can turn the tide here and start seeing more of these red zip codes turn into light green and dark green. We've just got to do that for our community. So I encourage all of us to get started in working on that real soon. This is all part of a larger report that Mary alluded to, and you can find that by going on our website, www.livewellsiouxfalls.org, and I encourage you to do that. And again, please talk to the folks that helped put this report together. They know this report inside and out, and if you have any questions about any of the data, I'm sure they'd be happy to talk with you. But before we conclude, I do want to again say how much we appreciate our community partners, members of our community, the residents who completed the resident survey, folks who came for the focus groups. It was really important for us to gain a complete and comprehensive picture of the health of our community. And I appreciate those who are partnering on Big Squeeze this month on our hypertension awareness campaign. So we look forward to working with all of you and others as we continue to develop the strategies we need to create a healthier Sioux Falls and live well Sioux Falls. So thank you very much for being here.